Nice deep inhale in through the nose.
Sometimes a deep breath is vital.
And exhale.
A moment to pause, reflect, process.
Trauma is going to happen. I don't think there's a way around it.
Even at a young age.
But once you actually learn how to cope and how to deal, now that gives you a different perspective.
Sharonda Ford started Brown Skin Yoga in Whitehaven with the intent to teach yoga to underserved communities. She started working with her first school right as the pandemic hit.
When we were practicing yoga on Zoom, sometimes the parents, they would be in the background and they would come and join us and they would practice as well.
She says her curriculum became crucial, helping students improve their focus, self-awareness, and relieve stress and anxiety. Memphis Shelby County Schools also saw the benefits.
Bow pose is gonna look like this.
She's now working with truant students, athletes, and in multiple schools. On this day in May, we met her at A. Maceo Walker Middle. She taught several poses and breathing techniques.
Take some of that wisdom that you have and start pouring it into things like this.
Their PE and health teacher, Charles Peace, says most of the students had never done yoga.
I think there's so many negative influences on our youth, especially in the inner city.
Inhale, legs lift. Hold it there.
I really want to ensure that the district is focusing on the whole child, not just them as far as academics, but them socially, physically, and emotionally as well.
And exhale.
I heard the birds, felt the sun on my face. It was really nice.
This student loved it.
You wouldn't expect this to come from school, and it could really help you calm down and take a moment.
Take a moment in a troubling time for kids. For the past decade, mental health concerns in children have been steadily rising. Then the pandemic hit, ushering in a new set of challenges like social isolation, devastating losses, and sudden financial family hardships. The CDC reported during the pandemic, 55% of children were emotionally abused by their parent or caregiver. 11% were physically abused. Schools, normally there to keep children safe and connect them to services, were virtual. Emergency department visits for mental health rose among children. There was hope it would all get better as life got back to normal, but social workers report many kids are still experiencing a high level of mental health challenges, forcing medical experts to sound the alarm, like Dr. Alpha Stewart.
We're in a public health emergency. There is no question.
Stewart is the director of the Center for Youth Advocacy and Wellbeing at UT Health, which works with children with mental illness, trauma, those being pulled into gangs or are already in the system.
So we're in this emergency, then why aren't more people responding?
Well, you know, that's a very good question, and we try to answer that every day with the resources that we offer. More people don't respond because for the most part, they don't know what to do.
She recently held a trauma summit to address it.
I tell people talking about trauma and understanding behavior as a result of trauma is not an excuse, it's an explanation.
Stewart says a child's brain isn't developed. They're going through puberty, and those changes drive them to seek approval from their peers. Then add new challenges from the pandemic and core issues like poverty, structural racism, housing instability, and food insecurity.
If our only response is we're going to lock you up, then we're creating the monsters that we fear.
To top it off, violence is plaguing the city. Children bearing witness far too often, navigating their way through crime tape on their way to school. They have become victims or lost relatives. That adds more trauma.
It's not a life that the children in Memphis want.
Students have called out for help on our newscast as their schools have tried to address their mounting needs. Memphis Shelby County Schools didn't agree to an interview, but told us it's invested in health, safety, and social emotional learning, including $100 million in supports, social workers, behavior specialists, and family wellness centers. Another $500,000 from CDC COVID mental health supplements, and $22 million in mentors and counseling programs. Its initiatives include trauma-informed parenting sessions and an emotional support hotline. MSCS assured us progress is being made, claiming it's reached thousands of students and curbed suspensions and gang-related incidents. They vow to continue to grow partnerships.
Nice deep inhale in through the nose.
Like this one with Ford.
One of the biggest takeaways is that we're still recovering.
And believes focusing on prevention,
love and light,
is the only way out.
Namaste.
Jessica Gertler, WREG News Channel 3.